A 32 years old man undergo appendicectomy. A large carcinoid tumor is identified and completion of the right hemicolectomy is performed. He is well for several months and then develops symptoms of palpitation and facial flushing. Which of the following diagnostic marker should be requested? So, a patient undergo appendicectomy and large carcinoid tumor is identified and also their right hemicolectomy done. And what happened after that? Some days he also developed the palpitation, which is the clinical feature of the carcinoid syndrome, and facial flushing. Also, it is the clinical feature of the carcinoid syndrome. So, first of all, let's see. This is a normal colon. Here, this is the normal colon, and there, this is the appendix. So, right hemicolectomy, it includes the excision of this part, that means the ascending colon, hepatic flexure, and part of the transverse colon, also the appendix. So in case of the large carcinoid tumor, the right hemicolectomy was done, but after that the palpitation and facial flushing developed. That means the carcinoid syndrome present. That means this carcinoid tumor, it also present another part of the gastrointestinal tract, another part of the body. So how we can diagnose that it is this clinical feature is caused by the carcinoid syndrome? So here the options are the alpha fetoprotein, urinary 5-hydroxy indole acetic acid, or 5 here, urinary catecholamine, urinary BMA, and none of the above. So in case of the carcinoid syndrome, 3 important chemical substances is very, very important, which will be discussed later. So let's see, what is the carcinoid syndrome? The carcinoid syndrome, it is a special type of the tumor, and it is originated from the neuroendocrine cell, which is mainly present in the small intestine but may be present in other part of the body, and it secretes the serotonin. This is the first important chemical substances, that means the serotonin. So serotonin, it is released by the carcinoid tumor. Here one important point, one is the carcinoid syndrome, and another one is the carcinoid tumor. The carcinoid tumor, when there is only tumor present, and this is known as the carcinoid tumor. But when there is tumor present plus clinical feature present, in this condition it is the syndrome. So syndrome develop when there is the clinical feature, and it can occur outside the gastrointestinal tract, like the bronchus, rectum, and also the rectum, which is part of the intestine. And hormonal syndrome mainly develop when it is spread outside the bowel. That means when the serotonin goes to the liver and it converted to another active metabolites, in this condition clinical feature develop. And what are the clinical feature? The clinical feature are the flushing face, palpitation, pulmonary valve stenosis, and tricuspid regurgitation, bronchial asthma, severe diarrhea. So these are the clinical features. Flushing face and palpitation, these two are the most common and early manifestation, and other develop later. And here the investigation, this is the most important part. First of all, in the blood we can find the chromogranin A, and it is the diagnostic for carcinoid syndrome. Also there is another, which is the 5-hydroxy indole acetic acid, or 5 here, it found in the urine. So this one is also very important, that in the blood it is the chromogranin A. In case of the urine, it is 5 here, or 5-hydroxy indole acetic acid. And also there are other options, including the somatostatin receptor scintigraphy and CT scan. And what is the treatment? The actual treatment is the surgical removal. But when there is tumor, we should remove the tumor first, and then octreotide. So the carcinoid syndrome, here rule of 3 is important. First of all, it is 1/3 is multiple. That means 1/3 it present secondary site outside the primary, and 1/3 of the small intestine, 1/3 metastasized, and 1/3 second tumor. That means another tumor present in the part of the body. So multiple carcinoid tumor may be present. So in this case, the surgeon removed carcinoid tumor from the appendix, but probably it present in the another side. And the liver metastases are necessary for presence of carcinoid syndrome, because when there is syndrome, that means clinical fissure develop. In this condition, the serotonin must have go through the liver. So which is the diagnostic marker for this carcinoid tumor? There are two important. One is the 5-hydroxyindole acetic acid in the urine, which is present here, and in the blood there is the chromogranin A, and also the tumor, it secretes the serotonin. So these three important name is very important for the carcinoid syndrome. Thank you all.